Favorite meeting ever. I love the IDF meeting. It's an honor to be invited here, and I hope to just give you a brief overview of the new program that we got funded with the IDF, the SCID Compass program. And it's a 2-year program that really, now that we have universal screening, we need to close the loops. There's some problems that we have with newborn screening. We need better educational resources. We need better linkages for the parents to providers. The providers need resources as well. And the state labs also need help. So here are our goals. One is to generally increase the awareness and knowledge about SCID and newborn testing for SCID. To support the statewide newborn screening programs. We've heard, every state does it a little bit differently, and they have different needs depending on where you are and where the test occurs. And this, I think, is a critical part, and Dr. Buckley and Puck both mentioned it, to link families and children with SCID, especially those in underserved areas, to really make sure they get the best treatment. There are many states in the country that have no clinical immunologists or have no experienced transplanters that have ever transplanted a kid with SCID, and we need to make sure that if the baby is detected in a state that doesn't have a clinical immunologist or a center of excellence, that somehow we get that baby there to improve outcomes. We want to develop strategies for long-term follow-ups. May brought up the issue of idiopathic T-cell lymphopenia in newborns, something we didn't even know existed. It's critical that we find out what happens to those babies that have low T-cell counts but don't meet the criteria for SCID. We have partners. Obviously, the IDF is the main driving force and the PI in this grant. RTI helps us with, it's a nonprofit research institute, and helps us really sort of look at the processes that are ongoing for patients, families, etc. And to try to come up with conclusions based on their queries. The APL, or the Association of Public Health Labs, is really the technical part of this piece. They work to build effective lab systems in the United States and globally, so we're trying to cover all our bases here. So what are activities? One is a technical needs assessment. What do we need? What do the state labs need? How can we help them? What are the educational resources, etc.? A journey mapping exercise, which we went over yesterday, which is really fascinating. And I'm trying to get this over a little early because Heather Smith has some interesting stuff to talk about as well. But really, it was 7 families that had their baby picked up by the TREC assay in newborn screening, and sort of what their life experience was. And then there's a need assessment. What do the parents and caregivers need? And what are the professional needs? How can we close that gap? We also need to look at the data repositories. There's a whole bunch of places where data is being collected on SCID. How do we make sure they talk to each other? All these things are really important in improving long-term outcomes. And it's pretty clear we need to improve our educational resources so that, if you're baby has SCID and was detected in newborn screening, you aren't going to Dr. Google first. Dr. Google's good. I use it all the time. But and then this is just sort of the SCID family journeys I mentioned. 7 families were originally involved in And then they had a needs assessment, just sort of to go over what it was like, diagnosis, pre-treatment, treatment, post-treatment. And as a provider, it really made me realize some of the issues that I had never really appreciated. And so this is an ongoing project, and you'll hear about a little bit more about this as the day goes on. So where are we now? We are disseminating our parent-focused needs assessment survey. And I'll reiterate this, please participate in that. It's really important for us to find out what you need in order to address it. And we want to identify, we're looking at things like telemedicine is a possible way to address having a consulting immunologist in an area where there are no consulting immunologists. And to be honest, the clinical immunologists in general is a national need, and the idea that somehow people are going to relocate to, I'll just bring up, I don't know, North Dakota or whatever, it's just not going to happen. We need more. And so we got to figure out creative ways so that they can, so that your babies can get the care they need. We want to create new materials and resources, and in the end, we want to design a website where everyone can meet and gather and get the information they need all in one place. So it really addresses a lot of the pitfalls that we have now that we succeeded in getting nationwide newborn screening. How can you get involved? Okay, if you haven't done so yet, please complete our parent-focused needs assessment survey. There's a member of the SCID team at the table in the hallway outside. Alyssa there can help you. We really want, this is really important for us to figure out, how we can best help you, help the families really make this experience. It's always going to be tough, but make it better. And that's our goal, to improve outcomes and make the experience a little more seamless, realizing no one that goes through this sort of thing is going to have a completely seamless experience. I, again, want to thank you for, coming to the IDF meeting. I've been a clinical immunologist all my professional career. It's been an honor to take care of patients that have immune deficiency. They're the best patient. You're the best patients in the world. You're motivated to improve outcomes, help your kids. So thank you.